Hello, my name is Natalie, and my presentation is on the topic of hunger and obesity in elementary schools within poor communities throughout the United States. So, what exactly is food insecurity and obesity? Well, by definition and according to the World Health Organization, food insecurity is the state of being without reliable access to a sufficient quantity of affordable, nutritious food. And obesity is the abnormal access accumulation that presents a risk to health. So you may be asking yourself, okay, well, how could the two possibly go hand in hand? Well, the answer is more often than you think. Let's start with food insecurities. The U.S. Department of Agriculture reports that 15.7% of households within the U.S. are food insecure, and 7.7% of that number are food insecure children. This map gives us an overview of the states with the highest and lowest food insecure households, with some of the southern states being at the highest. All of this data averages out to 1 in 5 children who come from food insecure households, making that a total of 6.5 million children in the US alone. So now let's transition to childhood obesity. The national childhood obesity rate is at 18.5%. And that rate varies among different age groups and rises as children get older. For example, 13.9% of 2 to 5-year-olds, 18.4% of 6 to 11-year-olds, and 20.6% of 12 to 19-year-olds have obesity. And for this chart, the 2016 National Survey of Children's Health found combined overweight and obesity rates for children and teens ages 10 to 17 ranged from a low of 19.2% in Utah to a high of 37.7% in Tennessee, averaging out to 1 in 6 children who are obese and overweight. So, what are we doing about these public health issues? Well, currently, the USDA has several food and nutrition assistance programs. The two large ones are the Supplemental Nutrition Assistance Program, formerly known as food stamps, and a subcategory called the Women, Infants, and Children Program, also known as WIC. But in terms of making an impactful change in childhood obesity and food insecurities, the USDA has 4 different programs based on ensuring all children, regardless of their family's socioeconomic status, have the opportunity to receive a healthy and nutritious meal while at school. These programs are the National School Lunch Program, the School Breakfast Program, the Summer Food Service Program, and the After School Snacks and Suppers Program. So now that we know what the current public health approaches are, how successful are these programs? Well, let's start with the National School Lunch Program. It's the nation's second largest food and nutrition assistance program. And in 2016, the National School Lunch Program operated in over 100,000 public and nonprofit private schools, grades pre-K to 12, and provided low or free lunches to 30.4 million children daily. Second is the School Breakfast Program. This graph shows the status of average daily school breakfast participants from 1970 through 2016, where in 2016 it reached a total of 14.6 million students. Continuing, the Summer Food Service Program. This is a U.S. map that shows the percentage of populations participating in this program, where in 2016, the Summer Food Service Program provided meals to 2.8 million children each day at 48,619 sites during the program's peak month of July. And last but not least, the after-school snacks and suppers. This graph shows the after-school snacks served annually through the National School Lunch Program from 2003 through 2016, reaching an average of 1.3 million snacks served daily and almost 211 million snacks served that year. So it's obvious to see these efforts are successful, but there's still a lot of work that needs to be done. Moving forward, it's important to know who the key stakeholders are who make it their mission to support families who deal with these type of public health issues. The first, as we know, is the USDA. Another great organization called the Hunger, Health, Feeding America program, where their mission is to educate, connect, and engage cross-sector professionals on the intersections of food insecurity and nutrition health. Third is the Kids Can Make a Difference program, which inspires kids to end hunger and poverty in their communities. And last is the Children's Defense Fund, which works to give every child what they need to thrive and reach their full potential. With the help of programs such as these, there's a lot of changes to be made, but we also need your help, and that sort of impactful change can be done at 3 different levels. Start off with state legislators and state governors. Rally a team and help shed light on areas of concern within their state in a way that will grab their attention. Second, we also require changes from a government level. Making change nationwide is the best way to ensure every child gets a fair chance at living a healthy life, regardless of where they live. But most importantly, rally those around you. There is nothing like local community support and community involvement. A little can go a long way. In conclusion, I leave you with one final quote from author and speaker Zig Ziglar. Our children are our only hope for the future, but we are their only hope for their present and their future. Thanks so much for listening.